Hi again, and welcome to Pearl Magazine. As the coronavirus spread through Hong Kong at the beginning of the year, many people who felt ill were unwilling to risk even a visit to the clinic or hospital for fear of the virus. Luckily, in today's world of remote working, patients could still see doctors through online and mobile platforms or telemedicine.
Well, in many countries, telemedicine apps linking patients to doctors via mobile phone or notebooks have been in use for years. But in Hong Kong, it's just being rolled out now. The virus has pushed faster adoption of these services, which make it more convenient, virus or not, for patients to see their doctors. Watch this.
Imagine you're staying at home and your doctor will be seeing your vital sign in a real-time manner while he's seeing you.
So if I wear this all the time, then they can always check and see if I have any spikes?
Yeah. You can share all this record to your relatives. In case of for elderly or you have some chronic disease, your doctor or your nurse may not be seeing you 24/7 around the clock. But with this kind of wearable device, they'll be seeing you and you can share all your data.
Telemedicine, or medical consults through telecoms platforms, which include video and audio, through your phone or laptop, has been around for many years. In 2018, telemedicine picked up lots of traction overseas as medical councils set up guidelines for practitioners to follow. In Hong Kong, guidelines were set up by the Medical Council in December of last year. Dr. Daniel Tong, head of the Hong Kong Telemedicine Association, set up his group several years ago to link doctors with IT experts so they could work together on what technology doctors needed to help their patients. But their remit has expanded to raise issues that need to be addressed in the guidelines.
We found, we are sort of the activities holding up by the regulations. If you say a doctor want to use this technology, but then it's limited by the regulation. Delivery medication is held up by the regulation. Can we ask those who set up the regulation, can we change this? Which kind of medication can we deliver, and to what extent can we do it safely? We don't want to break the rule, but then we want to provide the best service for our patient. And these patients, we are one of them in future, and near future.
He says telemonitoring is another big area of development, which goes hand in hand with the currently new consulting platforms in Hong Kong.
Some cardiac disease, you just by careful monitoring can reduce the mortality rates without any change of medication, without the death rates, more than 30%. It's research based on data from the university professor developed locally. Why can't we implement all this? We just need to gather all these people together, let the government know, please change, and we're going to improve build a better future.
Chi Man Lam, founder and CEO of a company that develops telemedicine platforms, currently has a free app where users can check their skin, teeth, hair, and eye health.
We want to move people's concept and minds from sick care to healthcare. So by simply taking a selfie, our app will be able to help you to diagnose some premature syndrome or disease.
He's currently working on an app for a large group of clinics to work hand in hand with an insurance company. The application allows you to book your appointment, have your consultation, get your prescription, referral letter, and even has a delivery service for the latter if a patient is unable to pick them up. The cost of consultation is the same as if you go in person.
We launched a pilot program since early April to test that whether this is an option, for the patient that's covered by insurance, that will they choose an online option rather than going to the clinic. Because the guideline is pretty new still to the doctors, and the doctors are very conservative, want to stick to, the clinical governance, very much. We can see that those patients have a busy schedule. They just have 5 to 10 minutes, do not even have the traveling time, and video consultation to them actually is a good option.
Wendy, whose company is part of the pilot scheme, tried it. She prefers not to be seen.
The doctor was patient and asked detailed questions. It took us around half an hour. The doctor was friendly, even asked if I needed a sick leave letter or referral letters. But the most amazing part is they have a delivery service. When I paid online, they quickly sent me a confirmation email, and the next day, they delivered the medicine to my office. The whole process saved me a lot of time. Because I work 9 to 6, and if I want to take one day leave to see a doctor, I have to find someone to take care of my work. Now I get to see the doctor face to face in about 10 minutes through their online channel.
The clinic's pilot scheme currently includes 20 doctors and 20,000 members in corporate insurance plans. Both the clinic and insurance companies say they're still learning what their clients want.
Our plan was to launch that sort of Q3 or Q4 of this year, and then coronavirus came along around Chinese New Year. So we very quickly found a partner in Quality Healthcare and have launched our telemedicine service with them back in April to a relatively small proportion of our customer base.
Is there a particular profile, would you say, of those who are using it more?
Probably our customers under 45 have probably been the early adapters. During the COVID situation, people didn't really want to go into clinics. They didn't want to go and see their GP. They were scared. This has given people another avenue, not just a convenience, but also a safety angle for them to play.
The clinic group is also working with the government to handle some of the PCR testing for the virus.
The government is providing PCR tests free to all patients have a symptom. So we choose to provide an easier option for them. They don't need to go to the clinic, but we can, pick up the sample and they drop it back to the government center. People are screened once out of their airport or going to the public hospital. We are supporting this program very much, to either collect the sample in our clinic physically or provide a video consultation. So to collect the sample, from the patient at home. The major objective is to give people ease of healthcare. So they don't necessarily walk out of their home, especially if they suspect they are not feeling very well.
With telemedicine, patients can choose whether or not to come into a clinic by using one of these with their doctor. They can even have their medication picked up or delivered. But the medical community is still hammering out the details of what can and can't be done through remote consults. Even without formal applications, many doctors are already adopting telemedicine using existing video conferencing platforms. Dr. Joyce Lai, AGP, says COVID-19 really kept her patients from coming to see her. So instead, they saw each other over existing online platforms.
I started telemedicine in my clinic around January when COVID-19 started. And since then, more and more patients have tried it, liked it, and at one point, I think I transferred almost all my patients online. I think it really works for a lot of patients, especially those with chronic conditions, those parents who have to homeschool, the busy workers, and even some who just prefer to be at home because of safety and health reasons.
Bosun Hao was one such patient. He had injured himself during the height of the coronavirus pandemic in Hong Kong and wanted to avoid contact with other people as much as possible.
Back in March, I had stubbed my toe and at the time was very much concerned, I think, given COVID. Clearly, the toe was not in a good shape, and therefore, we thought that the best thing for me to do was to at least get some physician kind of consultation on it.
It could be fractured, it could be dislocated, but we can speed up that process faster by just directly bringing them straight in to get an x-ray to get it done. It saves time from them having to come in for a consultation, and therefore we can just immediately see online what the results are and redirect them if necessary.
I would ask Stephen questions about, look, which imaging center would you recommend? And she had provided a number of options and said, these are perhaps the ones that we are aware of that are taking, kind of the utmost precautions.
Dr. Lai says telemedicine does have its limitations since there are certain things you can't do over video, such as anything using instruments.
For example, I won't be able to do a pap smear. I won't be able to take blood or take any bodily fluids, for example. There are newer companies trying to create new apparatus which is directly connected to a phone or directly connected to the office so that we can see particular smaller orifices, which normally would be much easier to see when you're in face-to-face. So even with ECG, with stethoscope, I think technology is evolving. We're just moving with the times. It's a fluid situation.
Oh, yeah.
Dr. Tong agrees. There is still room to grow with new technologies being developed. Not only do these new technologies save time, they also save money. He says a study done back in 2008 in Shatin showed that using cameras together with consults for a group of institutionalized elderly brought costs down by a whopping 90%.
They save a lot of resources, time, manpower, and the calculated cost is just 1/10 of the medical costs spent.
He says it's important to adopt new and tested technologies and move quickly to create guidelines and regulations, which could ease some of the deficiencies in the health sector.
Facing the aging populations, the demands increase. I would like to see using the telemedicine. We're not talking about shortage of doctor. Instead, we increase the efficiency of the doctor and the healthcare system. We're not talking about money. Come on, you get a lot of technology to overcome this problem. And if the technology can help, let's use it. And you're not talking about we need more doctor. You need acceptance from the doctor side, from the patient side, and the whole society as well. But I hope people open their eyes.